To those who want to dance again, cheer again, hug again, to play, to work, to visit, to breathe. Now is not the time to give up. We are stronger than this virus. When it's your turn, roll up your sleeve and stick it to COVID.
What I miss is being out there, coming through the gate and getting ready to play. I miss the noise that Rider fans bring. If I was talking to Rider fans, I would say, get your shot, be ready, because we're going to have a football season and we need you in the stadium.
If you ever had to look a child in the eye that's relying on you to protect them, would you say, yes, I will protect you? And that's essentially it.
Thanks everyone for taking the time to join us today. From the Legislative Building in Regina, we have Health Minister Paul Merriman. As well, we'll be joined by SHA CEO Scott Livingston and Saskatchewan's Chief Medical Health Officer, Dr. Shahab. We'll start with opening remarks from Minister Merriman.
Thanks, Matt. Good afternoon, and thank you for joining us today. Saskatchewan's vaccination program continues to lead our nation. Our dedicated healthcare workers have now administered more than 230,000 COVID-19 vaccine shots throughout Saskatchewan. That's a rate of nearly 20,000 doses per 100,000 people, the highest per capita vaccination rate in any province in Canada. That means Saskatchewan's vaccine program is protecting our residents faster than any other province. Most importantly, we are protecting our most vulnerable citizens first. Residents in our long-term care homes and personal care homes are now close to being fully vaccinated. Over 80% of Saskatchewan residents age 80 plus, over 70% of people in their 70s, and over 35% of people in their 60s have now received at least their first shot. Overall, about 55% of Saskatchewan residents over the age of 60 have now received their first dose. That is so important because about 60% of all of our hospitalization and 85% of all COVID-related deaths in our province have been people over the age of 60. So vaccinations reduce those serious outcomes amongst our seniors. In fact, that's already happening. Dr. Shahab will have more to say about that in just a minute. However, the risk of contracting and transmitting COVID-19 remains high for people of all ages if you have not been vaccinated yet. And that's why it's so important for everyone, when it's your turn, do your part, stick it to COVID, and get vaccinated. That's the very best way to protect yourself and those around you. And that is the way to the end of this pandemic. In fact, it's the only way to the end of this pandemic. So once again, I want to thank the thousands of healthcare workers and other support staff who are leading this massive effort, vaccinating thousands of Saskatchewan people every day in every part of the province, 7 days a week. Thank you for working throughout the Easter weekend from all of us. And thank you to the thousands of people in Saskatchewan who have taken the time to make your appointments or line up at the drive-through clinic and get vaccinated. There are now more opportunities to get your shot. Appointment clinics are now operating in over 100 locations throughout our province. Mobile clinics are visiting congregate living locations like group homes and shelters. If you are 58 years or older, You can book an appointment at the nearest clinic, online, or by the phone. Anyone 50 or older that is living in the far north, people who are extremely clinically vulnerable, and priority healthcare workers can book an appointment by phone. Drive-through clinics are now open in Regina, Saskatoon, Swift Current, Weyburn, Yorkton, Prince Albert, North Battleford, Warman, and Lloydminster for anyone 55 and older. Walk-in clinics are open today in Moose Jaw and Kindersley. And drive-through clinic will be open in Moose Jaw on Friday. So as you can see, there are lots of different opportunities to get vaccinated when it's your turn. As Dr. Shahab has said many times, the right vaccine is the one that's available for you now. It's how you protect yourself and those around you. It's how we get through this pandemic. So when it's your turn, please book your appointments, go to a drive-through, roll up your sleeve, and stick it to COVID. While our vaccine rollout is going extremely well, we still don't have enough vaccines for everyone. And that means we have to continue being extremely cautious to stop the spread of COVID-19 and the variants. Today, we are extending all current public health orders in all parts of the province by 2 more weeks to April 26th. By then, we will have a lot more people vaccinated, and I hope we can start looking at relaxing some of those restrictions. But it's too soon to tell just yet. That can only happen if we see the case numbers start to decline. And the way to achieve that is by following all the public health orders and guidelines set out by Dr. Shahab and his team. And when it's your turn, please go and get vaccinated. Dr. Shahab?
Thank you, Mr. So I will maybe just start with some opening remarks and then go into my brief presentation. So first of all, I'd like to start by offering my condolences to the families and friends of the 10 Saskatchewan residents of all ages who have passed away due to COVID-19 since last Thursday. This continues, as the Minister said, to demonstrate the current challenges that variants are posing, not just to us in Saskatchewan, but in Canada and around the world. And while, Saskatchewan, we have had high case numbers for a while, I think it's concerning to see that, many parts of Canada now have high case numbers throughout Canada, and I think this just speaks to the fact that we are now, while on the plus side, we are, getting more and more people vaccinated, we are at the same time seeing a third wave in Canada, as is being seen in many other parts of the world, primarily fueled by variants of concern. Now, within Saskatchewan, we have to recognize that our third wave is quite intense in Regina, and hence the public health order and restrictions are quite significant in Regina. But certainly we have concerns in the south central and southeast parts of the province, and we have to make sure we have to do whatever we can individually to minimize transmission rising in other parts of Saskatchewan. I think that is going to be critical for over the next 4 to 6 weeks while our vaccination rates pick up. And the way we do this is obviously being very diligent wherever we are with the public health guidelines and orders, with the Reopen Saskatchewan guidelines. If we have to work outside the house, being very diligent with mask use, using the best PPE that's available to us, maintaining physical distance, good ventilation. The weather is great, we can open windows in whatever setting we are in, or otherwise improve ventilation. And although household gatherings are not allowed in Regina, and up to 3 households can form a bubble, being outdoors is critical. I think indoors we continue to see transmission throughout Saskatchewan, and sometimes the outcomes can be very challenging because in many cases, the individuals who get hospitalized or pass away are days from getting their vaccine. So I think we need to hold the line over the next 8 to 12 weeks till we are better protected through vaccination. If we look at our hospitalizations, we had our second, if we look at our case numbers, we had our second wave over December, January, February. We saw high case numbers during that time. For example, if you look at the month of January, we are seeing a similar increase in case numbers, but mostly in Regina and points south. This is 2 years worth of age data, but what we are seeing is that what we expect to see with B117, we've always had highest case numbers in 20 to 29 and then 30 to 39. But if we divide this by two, we are seeing an increase in especially the 10 to 19 age group, less so in the 0 to 9. But so this is the second highest category. And then, of course, we are still seeing case numbers 40 to 49. This age group is most likely to be at school or working outside the house, and lower case numbers in 60 to 69 and older. So compared to January, our case numbers are much lower, and part of this is attributable to vaccination. Similarly, if you look at hospitalizations, obviously all of us are concerned with the increase in hospitalization in any age group, and especially in young people, but we have to remember that even in January, we had a high number of hospitalizations in all age groups, but especially in people 60 and older. And then in March, we are seeing hospitalizations in all age groups, but they seem to be decreasing in 60 and older. And we think this is primarily the benefits of vaccination. And same for ICU admissions. We've always had ICU admissions in all age groups, and there may be a trending higher towards younger populations, which is typical of B117. But we have to recognize that B117 impacts all age groups. It's highly transmissible in all age groups, and it can cause higher severe outcomes, including death in all age groups. But even though it does that in younger, more so in young people compared to the previous strain, the mortality rate is much higher even with B117 in older age groups. But what we are seeing is less ICU admissions, thankfully, in 70 and older, because this is where, again, vaccination is having a significant impact compared to January. We are seeing less hospitalizations and less ICU admissions. And similarly, if you look at deaths again, these are the very tragic outcomes of our friends, neighbors, and family members in Saskatchewan, where unfortunately deaths have been seen even in January in all age groups, but certainly much higher rate in older than 50, especially 80 and older, both in long-term care and the community. And thankfully, we are seeing a declining trend in deaths in 80 and older, 70 and older, high uptake of vaccinations in these age groups, like the minister mentioned, improving uptake in 60 to 69. It's critical we continue with the age-based program, because even though mortality can happen in any age group, and while the case numbers are much higher in younger age groups, mortality continues to be higher in 50 and older. So it's critical we complete 50 to 59 and then continue down the age ranges. And again, when we look at our vaccination program, we can see that in January, where we looked at data earlier, we had only 3% of the population vaccinated with one dose and 15% of the residents. But now we have 133,000 first doses given, 80% of residents in Saskatchewan 80 and older vaccinated. So very different situation now. And we are projecting that by mid-April, 50 and older will be getting vaccinated throughout Saskatchewan. Right now, they are being offered vaccines in the far north. By end of April, 40 and older. By early May, 30 and older. And by mid-May, all adults 18 and older will be able to access vaccines. So we have to remember, so we are talking about 4 to 6 weeks, and all of us should be able to access vaccines 18 and older in Saskatchewan. And I think that is something that we need to remember and be ready to go forward and get the vaccine as soon as it's offered, because that is what is going to ultimately take us out of the pandemic, getting the first dose by end May, early June, and then starting immediately with second doses as soon as supplies allow. It won't be 4 months, it'll be well within 2 to 3 months most likely. Second dose will start first with people who got their first dose earlier in March. And while we are doing that, as the minister mentioned, it is critical we don't give up on our public health measures. Wearing a mask indoors when outside the home, physically distancing in indoor locations, but also outdoors, reducing non-essential contacts with anyone, utilizing curbside pickup, even where in restaurant dining is allowed, relying more on takeout, more on curbside pickup, even where we can make household bubbles, always having them outdoors. The weather is beautiful. We must spend time with others safely outdoors, not passing things back and forth, not meeting over food, but going for a walk or meeting while physically distant. I think these things are going to be critical. And of course, in workplaces, using the best PPE available. In personal care services, it could be a medical mask with a face shield. In other situations where you don't have to get closer than 2 meters, a reusable mask by both customers and staff, and all workers, or all employees, maintaining good ventilation. Those things are going to be critical as we look towards coming towards the end of the pandemic. Thank you.
Thank you, Dr. Shahab. Thank you, Minister Merriman. We'll now move to questions. We'll start in the room. Lynn?
Minister, the Premier said earlier today that the province is now considering adding frontline workers to priority vaccine plan, especially for larger workplaces. That's something you both said yesterday was not gonna happen. What changed between then and now, and where are those considerations at?
Well, I think as Dr. Shahab had outlined when we were doing this, is we still have to maintain with our age. Our majority of our system is age-based, and we've always had exceptions to that right from the beginning. We had frontline healthcare workers. We had employees of the long-term care and personal care homes that were of younger age that were getting done because of where their situation was. We've continued to do that. We've worked with our mobile clinics. We're doing it right now in group homes and with shelters and various other areas where our mobile clinics are going out to those specific locations and being able to vaccinate people in that. So we have done that. I did see what Premier had said. I think the intent of what he was saying is we're still going to prioritize people based on what their relation is to COVID. People that are front-facing to COVID, such as long-term care, nurses that are in COVID wards, all of those individuals are the ones that we have prioritized in the past and will continue to prioritize them.
Follow-up, Lynn?
Yeah, with all due respect, that didn't really seem to me to be what he had said. He was saying large workplaces with hundreds of workers. That's a very broad category that expands far beyond health workers. Is this something you guys are considering now, adding more than healthcare workers?
We have added more than healthcare workers right now. We've added in people in group homes, shelters. We've done a lot of areas of that. I think what the Premier is alluding to is we are continuously evolving what we are looking at. Last week we were looking at different things. This week we're looking at different groups that we're targeting. The age-based sequence is still the best way of getting the most vaccines out. That's been proven over the last 90 days. That's why we're able to lead the country in getting that, and we do target some specific groups. But the age-based sequence on our base vaccination program is working for us. That's why we're leading the country right now.
We'll take a question on the phones.
We have Kyle Benning with Global.
Good afternoon, Minister. In Saskatoon specifically, variant of concern case numbers have multiplied ninefold from last Monday to the press release that was given out yesterday. And actually, even today, it's gone up by another 18 or so cases. And we still haven't seen a confirmed P1 variant in the province. Does the government need to take a look at proactive measures considering the steps that Alberta and Ontario have taken to reduce the spread of COVID-19 over the last 24, 48 hours?
Yeah, I've seen what's happening in Ontario as far as their restrictions, and Alberta is just announcing theirs today. I think we do have very good restrictions. Our numbers, as you can see, that was just outlined in Dr. Shahab's presentation, with the active cases have gone down, the inpatient admissions, the ICU, from compared to where we were in January to right now, they are working. Outside of Regina, they're certainly working. We have a very low rate outside of Regina. Regina, there is certainly variants of concern that are here. They are moving across the province, But that's why we're rolling out our vaccines. That's why we've increased our vaccine. That's why we just opened the drive-through in Saskatoon, is to get more people vaccinated. So we are addressing that. We're not looking at any current public increase in public health measures right now. But I can tell you on a daily basis, myself, Dr. Shahab is in contact with his medical health officers to be able to find out if we need to move on anything and when we need to move on it. Our restrictions are working right now, with the exception of Regina, and that's why you saw us increase the restrictions in Regina over a temporary amount of time, just to be able to control things and try to contain it within Regina.
Follow up, Kyle?
Yeah, I guess the only thing is the variant numbers have gone up in Saskatoon. So even though more people are getting vaccinated, we know with these variants they can attack younger people, as Dr. Shahab mentioned earlier in this press conference. So I guess how much can the vaccines help if this variant is going for people who aren't vaccinated yet?
Well, I think the vaccine's the end goal. Between when we get that vaccine and get 2 shots into everybody in the province, or everybody that wants to be able to get vaccinated, the adhering to the public health measures. And all areas of the province have been doing well. The variant hit Regina, and it hit it really quickly, and we reacted very quickly to make sure that we had those restrictions in place. And you've seen the numbers starting to trend down slightly in Regina. Still too high, but they are starting to trend in the right direction. And even before that, they were stabilizing in and around that 100 range. So we have seen that the restrictions that we have put in place a couple of weeks ago are starting to take effect. They've stopped the increase of the numbers in Regina and starting to trend in the right direction. We're hoping that that trend continues for the foreseeable future.
Mark, do you have a question?
Demand has been low at these drive-through vaccination clinics this week. Looking at the wait times, it's been between 0 and 15 minutes. There's been no lineup. So if the vaccines are the way out of this pandemic and the reason why we're not putting stronger restrictions in, how concerning is it that we're not seeing a high demand at these clinics?
I think we're still seeing, Regina is not indicative of what's happening across the province. We haven't opened our clinic in Moose Jaw, which we're opening on Friday, our drive-through clinic. We're seeing that there was huge uptake. Just last week, there was 6-hour lineups at the drive-throughs in Saskatoon and in Regina. Just over the Easter weekend, there was huge lineups. There's a couple of things. We might be looking at whether all the age 55 and older that don't have a book appointment, they might be through already. So we're looking at other options. We want to see what the uptake is going to be like in Saskatoon. And there's about, from what last I heard, it was about an hour wait, which is a good amount of time. That encourages people that it's not going to take all day. We have to see how long that's going to, where Saskatoon's pulling from. Is it pulling from other areas of the province, the people that are coming in to Saskatoon? Regina has seen a slowdown, but this is our second drive-through in Regina. We've seen some great numbers go through Regina, and we're looking at options on whether we need to pivot that. What we are, what the wall is right now for our low side is the 55 for AstraZeneca right now, because we have our booked appointments with Moderna and Pfizer. NACI has recommended that we don't go below 55, and we're sticking to that. I know that there's news coming out of the EU on this. And if that gets lowered, then those drive-throughs will fold up. These are a great mechanism to be able to get a lot of people vaccinated in a short amount of time, but we're hemmed in right now by the age limit, and I'm hearing that this is typical across the province. We're also looking at avenues like putting these out through the pharmacies and some of our mobile clinics to be able to help move that AstraZeneca around the province.
Follow up, Mark?
Yes. With the variant cases in Saskatoon rising, why not be proactive? You talked a bit about this, but why not be proactive there before it gets to a situation like we're seeing in Regina?
Well, I think we do have the strictest, one of the strictest regimens or restrictions that we have in Canada right now. The numbers have bumped up a little bit in Saskatoon, but they're nowhere where they were back in January, and that's kind of outlined with Dr. Shahab's presentation. We want to be able to see what's happening in Saskatoon, what's the impact of the vaccines, and also is this variant starting to trend down in other areas of the province. We've seen our numbers come down a little bit today, and we're hoping that that continues across the province, not just in our major centers, but across the province.
Take a question on the phone.
We have Laura Sharpaletti with CBC.
Hi Hi there. Thanks for your time. I know we were just speaking about AstraZeneca, and with all the news about AstraZeneca, and we've been hearing anecdotally that a lot of people are a little worried about taking it. Is there any extra AstraZeneca sitting around because of that? And, what's going to happen with that if there is extra?
We've got a few options. Yes, we do have AstraZeneca on hand just to be able to fill, as I mentioned, we've got our drive-thrus that are opening and our walk-in clinics that are opening across the province, and we're making sure that we have enough inventory for them. We're also looking at other options. If we can't utilize AstraZeneca under the age of 55, then do we look at, specifically in the Regina area, we look at, can we get these out through the pharmacies across the province? Do we start looking at second doses? The people that went into the drive-through a few weeks ago in Regina, that's another option. We're looking at a lot of different avenues to be able to move this AstraZeneca, but it's a great vaccine, and it does guard, and Dr. Shahab will tell you about this, it does guard against severe outcomes and certainly deaths. It's the limiting factor of the age, which is a challenge for us right now, and that's not by the manufacturer. That's something that NACI has put in.
You have a follow-up, Laura?
I do. So going back to talking about the frontline workers and Premier Mo's comments this morning about possibly, hinting at mobile vaccination clinics for work sites. I haven't heard specifically about, grocery store clerks or people that work in large box stores that are, constantly being put at risk, but they, can't necessarily stay home sick because they might not have sick leave, etc. Have you been thinking about those groups of people specifically when you're considering, possibly opening up vaccinations to other people outside of the age groups?
Yeah, absolutely, Laura. We've been approached, my office has been approached by a lot of organizations, whether they be teachers or a specific like police, grocery store clerks, many different organizations that are all wanting to get the vaccine as soon as possible. And again, as a health minister, this is very encouraging. If we stepped away from our age-based sequencing, it would create some challenges. We don't have a very long, to move those groups up into the queue, the queue is not very long. As Dr. Shahab outlined, by April 26th, we're looking at everybody 40 and older having their first shot. So that's only a couple of weeks away. Age 30 and older by May 10. Again, these are rough numbers based on the vaccine volumes that we're getting through. So moving them up in the queue a couple of weeks could slow everything down on the mass vaccination program with our age-based sequence. So moving them up in the queue, I understand that they want to get moved up in the queue, but the queue isn't very long right now. We're looking at a queue of getting everybody over the age of 30 their shots by mid-May, so it's not a very long time frame. We're looking at 4 weeks. So to move that group up a couple of weeks to throw off the rest of the sequencing could create some challenges.
Coming back to the room, Murray?
Just a clarification, because you use the term all restrictions are being extended to the specific date. I think you mean all existing in-play restrictions, because obviously Regina has different restrictions. Sorry to be pedantic, but it's obviously...
No, that's correct, Murray. The health orders that are in Regina will maintain until that point in time, and Regina and area, which is in the Regina zone, and the rest of the province will maintain their current health orders at their level.
So people should know. By the way, I'm not counting this as a question because this is clarification, right? That's fine. Sorry.
You always find a way, Murray.
Question, though. Why are we not looking more seriously at extending Regina restrictions, particularly to Moose Jaw and particularly the southeast and to Saskatoon, to get ahead of this? Is it a matter of cost because you have to subsidize certain businesses? Is there a particular reason why it wouldn't be wise at this particular point, if you are extending restrictions, to further extend the restrictions to certain communities that are having this outbreak? Because if you look at the numbers right now, they are trending to where Regina was.
I understand that, and when we put the restrictions in Regina, we wanted to make sure that it was ring-fenced in and around Regina. We did see an uptake in Moose Jaw, and then we saw a slight uptake in Weyburn and in some of the other southwest areas. We've seen those numbers stabilize since that in the last few days. They have bounced around a little bit, but they are stabilizing, so we're looking at that. If it's something that we need to be able to do, we're always prepared to do that. but we want to make sure that the restrictions are complemented with compliance of the restrictions that we have seen, but also making sure that those restrictions are functional for the city. It's not a cost issue of that. We've every time that we have been able to make restrictions or change people's income, Minister Harrison and his office have been able to step up and provide some either incentives or some cash to be able to help those businesses. So it's not a cash issue. We've been able to do that. It's just more of, we just want to make sure that it's needed in those areas.
To Laura and Lynn's question, I'll just make this my last one. Can we get a better sense of who you would like, if you could, to receive the vaccines and how? And what I'm thinking about is that you have the Johnson & Johnson coming in. Don't you want that to go to communities where there's people of vulnerability that might not go back for a second dose to have one dose? Don't you want to go that to essential workers? I know it's difficult for you to do, and I understand what conceptually you're trying to do to get it to as many people, particularly older people that were more vulnerable. But now that you are in this next phase, can you blue sky for a moment and tell us who you would like to see, if you possibly could, vaccine first among the groups that would not be necessarily in chronological order, starting with a guy as old as me?
Who I would like to see have the vaccine in any, I'd like to see everybody get it, Murray. I mean, honestly, I would like to do that. And if you're asking about a specific business or a specific organization, we've targeted the ones that I think that are the most, that have the most negative impact by COVID, which is obviously our seniors and some of those people that are forward-facing in COVID. And I think we need to continue with that. It is extremely, and how we would like to do it, I guess, for the second part of your question, as soon as possible, whether it's drive-through. Again, I don't think that there's a vaccine hesitancy out there. I think there's people that are just making sure that they're able to get their vaccine. And, like, we're still seeing good lineups at all of the facilities, and people wanting to talk about vaccines is a very good thing.
Dr. Shahab, did you want to weigh in on Mary's question?
Yeah, thanks. So maybe on the first question and then on the second as well. So on the first, I think we have to recognize that the current restrictions throughout Saskatchewan was what brought the curve down in December. And the only thing that's changed is that you can, with caution, make household bubbles of up to 3 households, and worship places sizes have gone up. Everything is the same. Otherwise, that helped us control the fall surge in December and January. But I think 2 things we want to then add on to that. We all know that the variants are more transmissible. So definitely, just because you can make a household bubble doesn't mean that you have to, and certainly not inside your home. Meet and greet people outdoors. That has to be a main intent. Similarly, workplaces large and small. In terms of where is transmission happening, we are seeing outbreaks in all settings, large and small. Again, where it's always sometimes challenging to have the best PPE and maintain the 2-meter distance, maintain good ventilation in your workplace. Whenever there's a lapse there, B117 is less forgiving in terms of transmission than the earlier strain. And that's where we need to pay special attention. So again, wherever we are in Saskatchewan, if you can work from home, work from home. If you have to work in a work setting, enhance all your COVID protocols, including PPE, physical distancing, ventilation. And then secondly, quickly on the vaccine side, obviously we don't have a timeline, I think, and Mr. Merriman can confirm, but, we don't have a timeline of when and how much of Johnson & Johnson we will get. But obviously, any vaccine we get, we want it to go into arms as quickly as it comes. And I think right now it's not a vaccine preference. Obviously, Johnson & Johnson, 18 and older, 1 dose, and fridge stable, many benefits, Murray, like you said. But at this time, any vaccine that's available that you can get, you should get. And as Johnson & Johnson comes and maybe other products, the approach would be the same. Thank you.
We'll take another question on the phones.
We have Laura Fominov with CKOM.
Hi there. Thank you very much. Dr. Shahab had a graph with incidence of COVID-19 across Canada, with Ontario, Alberta, and BC at the top, followed very, very closely behind by Saskatchewan. We've been told for the last several weeks to hold the line as cases continually go up. So would it not help keep people in this province safer to have more public health restrictions, particularly in the Moose Jaw, Weyburn, Estevan area, and even Saskatoon now, as we wait these next 4 weeks for vaccines?
Thanks, Laura. I think, again, what we're seeing is these are good restrictions, as Dr. Shahab just outlined. These didn't bend the curve down before, and we're confident that they'll do that again. We want to make sure that we're always balancing the safety with people's freedoms, but also protecting their livelihood and their mental health. And that's a huge piece of that, is the mental health side of things for people to be able to interact. The restrictions that we have in place are very strict, the strictest ones in and around the Regina area. And we expect that people would be adhering to those restrictions. And I don't think more restrictions are the answer. I think adhering to the existing restrictions, that complemented with our vaccine program, is our best path on this.
Do you have a follow-up question, Lara?
Yeah, I do, and it's still along the same lines. But, Minister, if the variants of concern spread faster, they're deadlier, and they're affecting younger people right now who don't have the option to stay home. What do you say to them when they don't have the option?
Well, I think that if they don't have the option of working from home, as Dr. Shahab just outlined, is they need to make sure that they're masking, they're staying their 2 meters apart, they're doing all of the public health guidelines. But as Dr. Shahab outlined in his presentation, we have always had, in January comparison to March, we've had younger people that have been identified as being COVID positive. But the good news is those aren't our seniors and our most vulnerable citizens, is why we're doing that. Yes, the new variant does spread quicker, but we also know more about this, and that's why we're getting the vaccines out, and we're asking people to adhere to those public health guidelines. They're the best interim step until we can get people fully vaccinated.
We'll take another question on the phones.
We have Allison Sandstrom with PA Now.
Hi, thank you for taking my question. This is a question for Minister Merriman following up on the budget yesterday. There was not much money allocated towards the hospital in PA, and there is quite a bit of anticipation in the north and in Prince Albert about when shovels will be in the ground with that hospital, and I was wondering if you could provide any timeline on that project, or any details about if it has been delayed because of COVID, or if there could be any potential delays.
I don't see any potential delays for what's happening in that. We're still working with the Prince Albert Health Group. We're also working with SaskBuilds to make sure that this is done in a timely manner. There is money in the budget for Prince Albert as well as for Weyburn and the planning and process. So there's no delays that I know of, but I'll confirm that, Allison, and we'll get something sent up to you on the timelines or the most recent timelines. But to my knowledge, nothing has changed.
Do you have another question, Allison?
Yeah, I guess just in terms of when we're talking about a timely manner and nothing being delayed, what is the timeline you're looking at right now?
I'd have to check on to see what the exact current timeline of the PA hospital is. I don't have that at my fingertips right now, Allison, but I'll get that up to you. I'll have my office reach out today and get that to you.
Yes, Allison, we can get back to you later. We'll come back to the room for any additional questions. Lynn?
Yeah, we've seen Regina's hospital and ICU fill up with COVID patients. And maybe this is a question for Mr. Livingstone if he's on the line, but what would happen to the health system if what happened to Regina's hospital also happened in Saskatoon and Moose Jaw?
Well, I don't want to get into the what ifs, and Scott can talk about that, but we talk about what was in the ICU units in Regina, and then other ICUs in Moose Jaw. They're getting close to capacity in Moose Jaw, but we have to talk about a provincial system. That's why it's so important that we make sure that this doesn't take hold in Saskatoon and run crazy across the city of Saskatoon in the north, because that's a huge part of our provincial capacity. So, Scott, I don't know if you wanted to touch on Regina and Saskatoon, the provincial capacity?
Sure, just quickly to add to the Minister's answers, Lynn, as we've talked about many times over the last couple of weeks, since the beginning of the pandemic, we've had a defensive strategy and a surge plan, understanding that these waves were going to occur and we were going to have to respond. So with respect to what are we going to do next in Regina, as you know, we're already reducing some services in Regina as we have expanded critical care beds in the city of Regina. You've heard Derek and I talk about a stepwise approach to increasing capacity as we see COVID cases rise. That would be the same approach we'd apply throughout the province if we're seeing cases rise in Saskatoon and elsewhere. And again, also leveraging provincial capacity. But there is no doubt, and the thing that I think is important as we talk about COVID capacity in the hospitals, it's always important to remember that we build COVID capacity in our facilities at the expense of non-COVID care. So it's so important to protect ourselves within the healthcare system and our communities, because we are not providing a level of care for non-COVID patients, and have not been throughout the pandemic as we build this capacity to respond to COVID throughout the surges.
Take another question, Mark.
You mentioned that 40-year-olds and 30-year-olds are a few weeks away from getting vaccinated. So how would moving them up, the ones that are essential workers, slow down the vaccine plan if they're just a few weeks away? Why not get them done now as opposed to waiting a few weeks?
Well, Mark, if I move them up, then I have to move out the 50-year-olds. And that's where we've still seen the highest rate of hospitalization and the highest, as closest to 60, that's where we've seen the most deaths. So if we move them up into that category, we have to move somebody else out. So that's why if we start pulling people in and saying, okay, we're going to do just the grocery store workers, then we have to get them all to come in. It slows down our mass vaccination process because they're all not working on the same schedule. They can't come in at random times. It will just slow things down on the age-based sequencing. It's much easier for our staff and for the age-based sequencing and the organization of it is to do it in the age categories. It just works, and that's why we've been able to lead the country for the last at least 60 days on our immunization, is because we stuck to this age-based category when we saw some other provinces deviate from that, and we saw them slow down subsequently when they started to deviate from that.
Murray, do you have another question?
Yeah, you spoke earlier about large industrial places being somewhat of a potential place, if that's one place you could go, and that's what the Premier was talking about. I'm just wondering, are we, in places like Regina, are we looking at Evraz, are we looking at the co-op refinery, where you have large numbers clustered because of the nature of their job? Would that, I know there's some effort to start mobile clinics up in the north end of Regina privately and otherwise. Are we looking at that, sir?
Not actively, Murray. We're looking at are there some places where the mobile clinics are going to, like if we had a certain workplace that had an older demographic, we could certainly look at doing that to be able to fill that. But right now, we're just going to stick with our main sequencing. If we do have opportunities with our mobile clinics to do some targeting of some areas where there is an outbreak or there is something that is very concerning to Dr. Shahab and his team, and we've identified this as a potential that could be a spreader event or a super spreader event, then we would certainly investigate that if we have the vaccines on hand. Right now, we have a set amount of vaccines of Pfizer and Moderna, and those people are already booked. Where we have extra vaccines right now are the AstraZeneca, but as I mentioned, we're hemmed in by the 55 and older age restrictions that NACI's placed on us.
Would that suit your criteria of being efficient in terms of getting arms and needles if you could get a mobile clinic to a place where a lot of people are employed or going to for work?
We would have to check out to see what their vaccination rate is right now, what the age demographic is, what's the potential for spreading in that. There'd be a lot of factors in there, but I still believe that the fastest way of getting it and why we've been able to lead the country is because of our age base and sticking to our guns on that.
Perfect. Thanks, everybody. That concludes today's availability.
Thanks, guys.